Hey guys, welcome to Podiatry Practice Mastery. Don here. Today I'm going to go over kind of the one or two main things I got from my recent session at Strategic Coach. But before that, I want to tell you a little fiasco that happened prior to leaving. So I went to Coach this week. I went on it was on a Wednesday, so I had to fly out on a Tuesday. So typically what I do is I fly out. I have this whole kind of process. I use someone that schedules my travel. I don't know if you do things like that, but I have this woman. Her name is Sally, and she does a great job scheduling travel. So I don't schedule any more travel. I pay her whatever little fee is. It just makes life a lot easier. That's kind of one of the things I learn by doing these coaching things. Is I learn how to get other people to do stuff, and it just saves a lot of stress. Not that I couldn't do it, but I find by having others do it, it just simplifies my life so I can do a lot more other stuff. And that's actually got a comment from someone recently said, I don't know how you do all this stuff. Well, I only do the stuff I need to do, and everything else I delegate or pay people to do. That's kind of one of the keys. I think we tend to try to do too much stuff. But anyway, so one of the things I had to do, and I didn't realize, so I was getting ready to check in. I went via Porter, and I realized that to go to Canada, there was this new Canadian app, which is pretty easy to do. You have to document your vaccinations, take a picture of your vaccine card, which is easy. But what I didn't realize is that to come back to the United States, I needed a negative COVID test. And the problem was I was only going there for like less than 24 hours. So I was flying in at 9 at night, and I was leaving at 9 at night the next day. So how do you do that? Well, I realized I needed to do a COVID test before I left the United States so I could get back into the United States. It was kind of funny that way. But how do you do that at like 8 o'clock at night? Okay, on a Monday when I realized this, and I was flying out on a Tuesday. I worked half day Tuesday, and then I was going to the airport. You know, it's really hard to get a COVID test. Now that I look back, I could have done it at the airport, right? That's one thing that they do now. You pay about $60. But so we were kind of sitting, and I was like, oh boy, you get those little hot sweats, thinking, oh boy, am I going to be able to go, or am I going to be able to come back? It wasn't really going, it was coming back. And then as we were looking, there's this new company. They have these COVID tests. It's called Illum. And because I couldn't just do my own home COVID test, but I had to have it professionally proctored, I guess, or evaluated by someone. So this is kind of a neat idea. So when you go to CVS's, there is a place where you can buy all the COVID tests, and they have the mass-produced ones, which you like 2 tests for like $10, and there's like 500 of them there. Well, that's not the one you can buy when you travel, because you need this one proctored. But it's kind of a cool thing. So it's a home test. I found it only because I asked the guy, and it was like way in the corner, and there's only like 2 of them in the CVS when I went there, almost before closing time at 10 o'clock. And once you buy it, you schedule the time, and there's like times every 7 minutes. But the cool thing is, it has a little Bluetooth, almost like analyzer. So it's a Bluetooth thing that you hook up to your phone with an app, and it pairs with your phone, and then you do the little test, and you drop the little dots in there, and it sends you verified positive or negative results, which was really cool, so that I could use those to fly. So that was kind of a neat thing, that proctored exam. And I'm just kind of thinking, I think in the future, everything now connects with Bluetooth. So, people buy the new US may have one of these refrigerators that connects with Bluetooth. I'm sure there's going to be laundry machines that connect with Bluetooth. There's like these the home thermostat things that are connecting now to our cell phones. Like everything is smart. And I think probably the future is going to be something within our profession to have something more. I know they have a smart socks and stuff that they do. But anyway, that was kind of the whole almost missing my ability to return. But it ended up all working out. And that's something, also with working through things to when you feel those emotions, like how to work through them, it kind of takes practice, but you get better over time. But let me go into Coach. I went to Canada. I haven't been there for 2 years. We were doing it all virtual, and I have to tell you, in person is like 5 billion times better than virtual. I know some people, maybe if you're an introvert, it might be the same, but I think the camaraderie, the friendship, the seeing people, the connecting, all that stuff makes it so much better in person. And so, I've been thinking about with like Podiatry Practice Mastery. People have been asking me like, what are we going to do? I have these master classes at times. I'm just trying to save right now it's time, because I don't want to give up my nights and weekends to like do meetings or masterminds or things like that. What I like about Coach is they have like 4 meetings a year, and I fly somewhere and I meet with a small group and we kind of work on our business together. So I'm thinking that might be the format for Podiatry Practice Mastery, actually meeting up with people versus like, I think we're all kind of sick and tired of Zoom and these monthly Zoom things. I think just having maybe an all-day thing once a quarter would be a good thing. If you guys are interested, let me know. I'm looking at considering putting that together if there's a group that's interested. But so the main takeaway, I got actually before I left. I was interviewed by this guy named Chad Madden, and he has this program called Get Breakthrough. And I was kind of going through, and I was interviewed by him, and we were chatting, and he gave me an idea, and I don't know why I didn't think of it before, but this is the idea. And I've heard of it before, I just never did it. So during the pandemic, we were doing all these webinars, and we had like 70 or 80 people in our webinars, and it worked well. Hence, I produced that webinar product. Okay, the products I'm usually selling are the stuff that I'm producing that people ask for. Okay, so I have this webinar product where I give all of my webinars out to people. Where I give all my webinars out to people, and so I have this product where I give all my webinars out to people, and what I find is that people. So what we did during the pandemic is we worked on webinars. So webinars were a method of getting in front of our patients, and we were only offering it to our current list. Okay, so our current list. And we had 60 or 70 people. We got the doctors on a call, on a Zoom call, and then we recorded it, and then we can give it to patients afterwards and things like that. That was my initial rendition. But what Chad recommended, he said, Don, all you really have to do is then you just do it in person. And I had 2 complaints. I said, one, well, I guess the pandemic is slowing down, so I think we can do it. But then I'm like, what happens if because our office isn't big enough, we don't have a huge room to have a ton of people. He said, well, that's even better. So what you do is you do them for like 20 people at a time. And then once it's full, you open up one to another group. And he said, the people that actually make appointments from those is about, they're super, super duper better than people that watch a webinar. Because what you can do is you can welcome there, you can, do your little talk, the same presentation that we did, but then at the end you can say, I'm going to give everyone my free book on it, and then I'm going to give you an opportunity to make an appointment with my assistant if you'd like to right now, based on what you've seen. So it would be a way of doing targeted marketing. So we could do Google AdWords or even Facebook ads for our surrounding community, not for our current patients, but for other people around. And once you can have a limited seating, right? So once again, it puts a sign of scarcity. And once it fills up, you can offer it to other people. So I'm planning on using the same system I used before with Calendly. Basically, people will pick the day and only have one day available. Once that fills up, then I can open up another one and somehow do some type of I'm not sure if it's a bribe or what, but like making people pay to like reserve their spot, and then you refund it, or offering them a free book just to make sure they actually show up for it, and then have it in the office. So that was the one big takeaway. And he recommended doing it like monthly or even weekly or something like that. So I'm not exactly sure how it's going to work. I'm thinking about doing a test. So basically testing, doing it one day live, and then doing it another day virtual, and see which one has a better result in getting patients in. And you could also offer it to the current list, and then my brain continues to multiply this. So I think, well, then I could also invite people from our local shoe store. Then I can invite people from these physical therapy practices. Then I can invite, even do this at the physical therapy practice, do a live lecture there for their patients and things like that. So these different types of collaborations. I could send a letter to the primary care saying that we're doing it and inviting them and their patients to it. So kind of having it as something as a community event periodically, and get your list of the main 2 or 3 things that people want to come for. So that was the one takeaway from Coach. and I was able to work on it there. There's certain thinking techniques called the impact filter and strategy circle, which are both things you can find if you just Google strategic coach, impact filter, and strategy circle. These are methods of thinking through ideas. That was the one idea. The second idea, what I got from, I was talking to some financial planners, and this is the benefit of being in a mastermind group that's not just podiatrists, right? I think there's a certain benefit to being podiatry specific, but I think there's another benefit to be with other people. And the second idea was a lot of these guys, they do financial planning, and they do these things called like an intro, like talk with people, and kind of almost like a new patient visit, I guess we would call it. And what they're using is a slide deck, and then they take these slide decks and then they ask certain questions of their clients, and they actually fill in the slide deck as they're doing it. And then what they do is afterwards, they give them a copy of the slide deck, because the slide deck has a lot of really, really big value for them, because it shows exactly like what's on their mind, what's working for, like something called a DOS conversation. What are the dangers, opportunities, and the strengths? So basically for our patients, what's causing them pain, what are they excited about, and what's going well for them. And you would go into that, so you have that all documented for them. Then you talk about their condition, how you're going to treat it, and the plan. You put all that into a Google Doc or Google Slides. And I'm already doing that with the slides. And so the idea was then you would take one slide deck per patient, and you would, I don't know, somehow put their name, or I don't know if we might have to be careful of HIPAA, so I may put in maybe their medical record number or their phone number, like naming it that way, and then sending it to their email so they can have access to all those slides and look at them and kind of look at what we thought, look at the plan, and things like that. So it might be just a way of simplifying what I'm already currently doing, because currently I use the slide deck and then I send them a copy of it, but there's nothing really personalized in it. So I kind of like this idea of personalizing it. Anyway, those are the thoughts from Strategic Coach and from this last course. Those are the two main things I'm going to kind of be working on now. Anyway, love to know your opinion and your thoughts on things. Okay, guys, have a good one.